Hi, everybody. Welcome to week 7. Happy St. Patrick's Day. I hope you're having a good week. So, this week, our discussion question has to do with curriculum design and evaluation. This is something I love doing. I love looking at systems, seeing what's out of date, seeing what's redundant, seeing what we can modify to enhance the students' learning. It's a really exciting process if you have a chance to be involved. So, curriculum design and evaluation can apply both to academia and the clinical setting because you have a curriculum in the clinical setting just like in academia. You have a curriculum for your initial orientation, for nurse precepting, for annual competency. So you're going to be able to use this competency regardless of the setting you're practicing in. When I was working at a local community college, first I chaired the nursing curriculum committee, and then I chaired the hospital-wide curriculum committee. And you really learn a lot about setting up curriculum, setting up objectives, how everything has to tie together, starting from the mission and the values, and then your total program outcomes, then your course outcomes, then your weekly or unit outcomes. So everything has to flow and tie together. And then, of course, we have to keep it up to date. And that's one of the huge challenges in nursing. And what we have been doing as new things come about is continuing to just add them to our current curriculum. And now we have curriculum that is just overwhelming. There's just not enough hours to teach. So a lot of programs are changing from a traditional curriculum where you have things like nursing foundations, Med-Surg 1 and 2, advanced Med-Surg, different things like that to divide up your curriculum, to a concept-based curriculum. In a concept-based curriculum, you teach concepts across the lifespan. An example might be respiration, and so, or oxygenation, whatever you want to call it. And so maybe you will start out with the neonate and how their physiology changes upon birth, and so how they become oxygenated, and you'll look at how lungs change over time. But in the adult population, you will be teaching students how to take care of respiratory patients, whether that's a pneumonia patient, a bronchiolitis patient, an ARDS patient. What are the key things to know when you have to take care of a respiratory patient? And then you'll be giving exemplars like ARDS and pneumonia and bronchiolitis and things like that. But it's much more focused on critical thinking within a certain population rather than memorizing every single dang diagnosis and how do you treat it. It's really interesting. So I'm attaching several things. Two of them are about setting up a concept-based curriculum and what's involved and choosing different concepts that you want to include. The other things like that aren't so pathophysiology related. For instance, you might have a safety concept that you want to incorporate throughout your whole program as a thread. So all sorts of different things. And then as far as changing curriculum, I've included a little bit older article, but it talks about in curriculum adding evidence-based practice to a pre-licensure curriculum and the process they went through and how they evaluated that. So it just gives you an example of how one school tackled changing their curriculum when there was this huge push to start incorporating evidence-based practice. All right, so there's that component. And then one of the things as you look through your book, The Halstead, and you look at the different components of the competency, there's one of them that you may not have considered, and that's how to incorporate community and clinical partnership and external sources. As you get more and more into academia, if you're on that side of things, it becomes harder and harder to keep up globally from your local hospitals to nationally to the world on changes in healthcare. And so you really need to tap those external resources and partnerships to get a heads up about those changes that might be occurring. And then also to see how these new ideas are being implemented locally, how you can improve your curriculum, how you can tweak your curriculum to better meet the community needs. So you'll see how you partner with external constituencies to be able to improve your program. Now, let's say you're in a hospital setting. Well, you're going to also have external constituencies. You're going to have accrediting agencies that you're going to have to learn from and constantly receive updates from. You're going to have new doctors, new surgeons, maybe new hospitalists, different things like that you're going to have to work with as far as making sure that your nurses are educated to new practices. You might have a brand new surgery being started in your hospital, or you might be incorporating robotic surgery. So many things that can change, and you can't be the only person who's trying to look out for those changes and react to them. So there is a large piece in nursing education that has to do with partnerships externally. So just a few things to think about with curriculum design and evaluation. I'm really looking forward to reading your posts and see what you have to say about this. And I hope you enjoy the articles that I'm posting. See you in the main forum.